I'm a mum to a boy, Liam, who's 6 years old and has Prader-Willi syndrome. Liam was diagnosed with Prader-Willi syndrome at 3 weeks old. At around 30 weeks gestation, the ultrasounds I was having started to show that his head was growing faster than his tummy, and by 37 weeks the obstetrician was concerned about this, so he was born by a C-section. He was also breech, and I think in hindsight there was a limited amount of movement in those last few weeks. Liam was our first child, and as a result of that we didn't really know that his sleepiness or difficulty feeding was anything unusual. The paediatrician told us that maybe he just needed a little bit more time to wake up. The first night he was born, he had low blood sugar levels and he also had a really low body temperature. So by the next morning, with the difficulty feeding as well, he was fed via a nasal gastric tube. Liam was very floppy and he didn't have a lot of muscle tone, so after 5 days we were transferred to a different hospital so he could be under the care of a neonatologist. At that point we started to see geneticists, physiotherapists, speech pathologists and neurologists to try and work out what was going on. He had tests including an MRI, an EEG and an X-ray, and then a whole lot of blood tests where they were testing for things like spinal muscular atrophy and muscular dystrophy, and Prader-Willi was in the mix as well.
Hello, my name is Dr. Onyun. I'm a pediatric endocrinologist at Royal North Shore Hospital in Sydney. So in a newborn age or neonatal age, the striking features are hypotonia or low muscle tone, or poor suck or poor feeding or poor appetite. And they may also have hip dysplasia, and in boys they may also have undescended testes. They often have very light skin or hypopigmentation, abnormal face and almond-shaped eyes. And once they get older to a childhood, starting from 18 months to 2 years, their appetite change from a poor appetite to a very high appetite. And then that will generally lead to obesity. It is a chromosomal disorder. It could be due to the deletion of the father's chromosome number 15q11 in the offspring, or offspring having 2 copies of mother's 15q11 chromosome, or the mutation at the imprinting center of the chromosome.
At 3 months, Liam started early intervention where we saw a physio, speech pathologist, and we attended play groups as well. We're well aware that the challenges of Prader-Willi syndrome will increase, probably exponentially as Liam grows older. He's already showing signs of anxiety when routines are changed, but so far we haven't seen the hyperphagia. We know that when the anxiety intensifies and the hyperphagia starts, that the challenging behaviours that come with that will become even more difficult.
The best option is to speak to your local geneticist and find out what tests are available. We usually ask for 1 methylation test and 2 FISH tests, which is fluorescent in situ hybridization, and 3 MLPA test, multiplex ligand-based probe amplification test.
For now though, while I recall those first 2 weeks of Liam's life being the most difficult ever for me and my family, certainly the last 6 years that we've had with Liam have been the most rewarding and the most enjoyable.